Welcome everyone. This is Dr. Jaitly, your cardiologist on your source, the video source of MuniMeterHealth. Yes, we are dedicated to teaching you about cardiology and also providing you the human heart awareness, mainly for our patients and the general masses as well. So this is a site which actually caters not only the continued medical education, which of course we are talking about in a great deal, and it is also for the patient education as well, and we're trying to see if we can enhance the patient health literacy, if you will. So, first things first, I always do the housekeeping rules here. Number one, if it's an emergency that you're having or anybody else is having and experiencing, please dial 911 if you're in the United States and call for an ambulance and get to the hospital, the nearest doctor if you can. And two, this is not a syllabus for my medical students, mind you. Please, this is a supplement to your syllabus that has been advised to you by the universities and your societies. And three, use this only as an educational tool. It's not a clinical advice, but an educational tool both for patients as well as doctors and the medical fraternity. So without any further ado, let's delve into the subject matter and understand what is stable angina and what kind of a counseling one can give. As a matter of fact, the doctors have the onus to give the counseling to all their stable angina patients, if you will. Okay, so very crucial, interesting aspect here. Let's delve into my little sketch that I normally draw. And this being your heart here, for instance, and the aorta shoots off here, and of course you have your aortic valves here, and this is your left main, which is dividing into left circ here, which is bordering the left heart border. Anterior descending sort of comes out here as well, and you can draw these branches if you will. And these branches, they tend to sort of intermix and intertwine amongst themselves, and you don't have to go into the details there much. This being the right coronary, which borders the right heart border and goes all the way again to the apex to supply that. And there's a nice posterior descending which shoots off, and this combines the coronary flow. So having understood what the coronary flow is, because coronaries are supplying the heart, just for the sake of the students, and the heart is supplying the body, as you know, with fresh oxygen, so up through the aorta. Now, what happens is when you have obstructions, say so you have CAD here and here and here and here. Now, you may have CAD, and let's draw quickly an artery here, which will define what the CAD looks like. So this way we have an idea. Now, obviously, the plaques will sit around here somewhere, and then numerous structures that make the plaque. For instance, the lipid content, the fibrin, and of course the platelets and the macrophages, and of course do not forget the LDL particles that go into the endothelium here within the cells. So this is where the plaques look like. Okay, so the flow is normally going in this direction, if you will, and then it speeds off here after the stenosis is compromised. So the whole idea is, or negotiated. So the whole idea is wanting to see if this is what the plaque looks like, and it could be stable. Now, many times it's stable for years, and that's what a stable angina is. We've talked about unstable angina in a different video. We've talked about acute myocardial infarction, acute coronary insufficiency, different. So what would you say? Now, a lot of people are walking around and doing their day-to-day activity in stable angina. So the focus in this video particularly is, well, how will you counsel these patients? Well, one of the things you'll certainly want to say, look, the patients actually, by hit and trial method, they try to understand what is good in their lifestyle. Okay, what can they do themselves? In other words, they learn to know that they can move around within the house themselves and without any episodes of angina. So that's one. So the patients themselves, they understand that. Now, a change in season, for instance. Now, if the winter comes around and all of a sudden you have 3 inches of snow at their steps, at the house, at their door, and around their walkway, and they indulge into going out and doing something like shoveling, that could be a problem. So that is something very, very important. So burst of activity related to seasonal or what have you, okay? Or the circumstance. So burst of activity, they learn to sort of automatically, the patients should be advised, and if they did not learn, that should be advised to them. Look, Do not go out into the snow. First of all, you have a cold, which will precipitate an angina, because cold precipitates heart rate increase, blood pressure increase, and will also increase the peripheral vascular resistance. So what happens is, because of the clamping mechanism within not only in the splanchnic but also in the peripheral muscles and under the skin, you're contributing to the peripheral vascular resistance, which actually goes up. So PVR goes up, your heart rate goes up, your blood pressure goes up, especially in the cold weather. Okay, so all of these are not a good idea to really go out in the cold and start digging out of those 3 inches of snow. So that's very, very important for all our stable angina patients. It's a caution, burst of activity like that. Seasonal. Now, we talked about seasonal, we talked about holidays. Let's understand what holidays do. Well, holidays precipitate a great deal of anxiety, remember that. Now, Thanksgiving is coming, or Christmas is on the way, Diwali is on the way in India and within the Indian subcontinent, and of course Indians like to celebrate that, and Eid. So all these festivals, they certainly make a person very anxious. You want to deck up the house, you want to clean the house, and you start doing all these bursts of activities. So holidays could precipitate. Not only good food comes on the table as well, and it's all rich, you know that. It's not healthy, unfortunately. But the fact is that, so anxiety, the food, and then of course, the extra activity that one does, so the higher activity that one indulges in. So it is very, very important that we do this counseling for them and advise accordingly. Similarly, so seasonal change we talked about, the holidays we talked about, and then we talked about, where are we here? And then we talked about the lifestyle. So they tend to, moving around within the house, taking a flight of stairs if that's comfortable for them, or mostly taking the elevators to get to the office, to the work, to the apartment, etc. So the lifestyle is automatically, they tend to, or most patients, I would say, they will tailor it to their lifestyle. And so this way, now remember, they are on nitroglycerin, some of them on beta blockers, okay? Very rarely they could be on a calcium blocker as well, because that's now way down on the list. And if they have hypertension, etc. But nitroglycerin beta blockers, they are wonderful agents for CAD or ischemia or angina, if you will. Okay, what is nitroglycerin? That's a vasodilator. And what is beta blocker? Beta blocker is actually decreasing the oxygen consumption. That's where the role is. So if you can provide more oxygen. So in other words, if you were to look at, now here is my favorite diagram here, if you will. And so if you were, this is the fulcrum and the balance. The balance is the supply here, for instance, and this is the demand for oxygen. Okay, so if the supply is tilted upwards and the demand is less, is that favorable for the coronaries? Yes. Why? Because obviously the demand is less and the supply is more. So what does nitroglycerin do? Nitroglycerin, guys, it works on supply. And beta blockers, what do? Beta blockers work on the demand. So they decrease the demand. So oxygen consumption is lessened. Okay, so as simple as that. So just now if the supply is compromised, which is in this case where you have CAD, coronary artery disease, that's where the supply is lessened and the demand is high, like in a heart rate increase and a blood pressure increase. It moves the fulcrum, the balance, into the opposite direction, and that's where the angina precipitates. So angina precipitates here when this is opposite. In other words, the supply is lessened. Supply is lessened and the demand is high. So you want to increase the supply. Remember, you want to increase the supply and you want to decrease the demand to improve the coronary flow. Quickly, also, I just want to tell you that obviously it's a very important function of the body. I just want to be straightforward and clear about it, because obviously sexual activity, for instance, a lot of people they ask that question and say, look, stable angina patients can or may not, etc. So that's one of the areas that commonly. Remember that sexual activity can actually amount to an activity where the heart rate can increase up to more than 120, and it's almost like climbing a flight of stairs. So this is, or even a flight and a half of stairs. So remember that. So it is a strenuous activity sometimes, and involves heart rate increase, the blood pressure increase, and peripheral vascular resistance increase, etc. So just be cautious of that. And again, sildenafil is a big no. Viagra or sildenafil, as they call it, because those are the PDIs, if you will, and these are they interact. Remember, they interact with nitroglycerin. So if somebody is on a nitroglycerin, no sildenafil, please. So that's one of the contraindications. However, can patients take Viagra or sildenafil if they were interested in getting the sexual activity, satisfied for themselves and for the partner? Yes, they may, but make sure they're not on nitroglycerin. And sometimes it's a lot easier to avoid this and take a beta blocker an hour before. So my recommendation to them is to take again, I'm not advising them, but I think a beta blocker, they can discuss that with their physicians, I should say, and a nitroglycerin maybe perhaps in half an hour before the activity. Now, a lot of the times patients resort to do other things, like they want to go skiing, for instance. So skiing, especially downhill skiing, and you're talking about country skiing, those are a big no. So they have to be very, very careful, because they really, the oxygen consumption is extremely high, and they may be compromised. And idea is that chronic stable angina, it's not like they should never have angina in their lives. They may have an episode of angina once in a while, so that's okay. They can take a nitroglycerin, they're good. But if the angina is occurring more frequently, it's occurring at lesser activity, that's called unstable angina. Now you're getting into the crescendo variety. So stable angina, yes, they may get angina once in a while. It's not like they'll never have angina, so that's why they carry the nitroglycerin all the time in their wallets. So the whole idea is wanting to see how best they can really be counseled for various activities. Again, lifestyle modification also includes diet, do not forget that, and cleaning out your habits. Hey, no smoking sign is on. And not only that, you also have you got to clean out your diet, your plate. Your plate should be more greener, more colorful, with veggies and less oil, less fat, and of course chicken and fish, as long as it's not fried. Okay, so grill it, broil it, bake it, if you will. But again, tend to eat healthier if you can, and that's very, very important. Daily walking certainly helps, because that really improves the entire circulations. All right, so this is a short video about counseling on patients of stable angina. Hope you enjoyed it. It's mainly for medical fraternity, and of course for general masses. I'm sure there's not much of a high-tech information that I really provided. So general masses also should really understand that, look, should they have chronic stable angina, how should they really be benefiting? And of course, go back and discuss with your doctors first before you take any of my advice. All I'm saying is that you have a better knowledge now to actually improve your health literacy factor, and this way you can interact with your physicians, with your care providers, in the hospitals, and the nurses, and the clinic settings. So this way you can really gain a better handle as to what's going on with your stable angina. Okay. So please continue following MuniMeterHealth, your favorite site, mainly for patient education and clinical education. And thank you again for watching me on this video. Until the next video, which is coming up soon. Okay, so long, Dr.